Hello and welcome to this live episode. Wishing everyone a very happy new year. I'm Dr. Mugdha Raut, a gynecologist and a clinical reproductive immunologist and co founder of Dr. Raut's Center for Reproductive Immunology, which is India's only dedicated center focused on immune related causes of infertility, pregnancy loss, and IVF failures. We at Dr. Raut's Center for Reproductive Immunology treat couples with unexplained repeated pregnancy loss, unexplained IVF failures, and unexplained infertility with the active immunomodulation, Imulate, which is our patented and branded process, and other passive individualized reproductive immunomodulatory treatments. We have our centers in Mumbai and many other cities in India. Today's topic is when everything looks perfect, why pregnancy still fails. It is the missing conversation no one is having. Today, let us have this missing yet honest immune conversation no one is having. Everything looks perfect, pregnancy still fails, whether in IVF cycles, natural conceptions, or unexplained infertility. Now, here there is immense mental and emotional discomfort, and not just for patients, it is for doctors too. The questions remain unanswered. Why is this happening? And what can I do now? What often gets missed here is a crucial conversation we are not having enough of. The immune system's role in accepting the pregnancy. What we usually hear is good embryos, normal reports, multiple IVF cycles, repeated miscarriages, and still no baby. If everything looks perfect on paper, why does pregnancy still fail? Today, I want to talk about this situation in fertility care, the immune system's role in pregnancy success, or the illusion of everything is normal. Let me ask you something honestly. How many times have you or your patient heard this sentence? Everything is normal. Hormones, normal. Scans, normal. Uterus, normal. Embryos, beautiful blastocysts. And yet, the pregnancy doesn't happen. Or worse, it happens and then quietly slips away. This is the most frustrating place to be in because when everything is normal, there is nothing left to fix, right? Many couples ask me, Doctor, if everything is normal, why does this keep happening to us? And many clinicians silently wonder, what am I missing? The truth is, normal on reports does not always mean ready for pregnancy. Most routine fertility evaluations focus on structure and numbers, hormones, anatomy, chromosomes, embryo grading. But pregnancy is not just a mechanical process. Pregnancy is a biological negotiation. The embryo arrives, and the mother's body must decide, do I accept this or do I fight it? And that decision is not made by the ultrasound machine, not by the embryo grade. It is made by the immune system. So when we say everything is normal, what we often mean is everything we measured looks normal. But what we didn't measure may be exactly where the problem lies. Pregnancy is not passive, it is immunologically active. Pregnancy is not a passive process. It is one of the most complex immune adaptations in the human body. The embryo is always 50% from the mother and 50% from the father. That means it is 50% different when using self eggs and 100% different when using donor eggs. Yet the mother's body must protect it, not reject it. This means the immune system must do the opposite of what it does everywhere else in the body. This requires a finely tuned immune balance involving immune tolerance, regulatory immune cells, protective antibodies, precisely timed immune signaling at implantation. When this balance is disturbed, implantation fails or pregnancy is lost. Why IVF failures and miscarriages stay unexplained? Nearly 40 to 50% of recurrent pregnancy losses and repeated IVF failures remain unexplained, not because there is no cause, but because the immune system is often not evaluated structurally. We continue to focus on embryo quality, endometrial thickness, hormones, but forget to ask one key question. Is the immune system ready to support the pregnancy? So let us go from question to diagnosis and treatment. Once we ask this question, the next one becomes critical. How do we find out? This is not something we can guess, and it is not something we can treat blindly. The immune system doesn't shout, it works silently in the background. And immune imbalance does not always appear on routine reports. This is why immune related reproductive failure often remains unexplained for years. What is needed is a structured immunological evaluation, not one isolated test, not empirical treatment, but a pattern based understanding of immune behavior. We assess excess immune activation, insufficient immune tolerance, deficient protective antibody response. Only then does treatment begin to make sense. Let me introduce the concept of immunomodulation. Once we understand the immune pattern, the goal is not to fight the immune system. The immune system is not the enemy. It is doing exactly what it is designed to do, protect the body. The problem arises when it does not recognize the pregnancy as something it has to protect. So the solution is not suppression, it is modulation. Immunomodulation means guiding the immune system, teaching it when to activate, when to calm down, and when to tolerate. Immunomodulation in pregnancy is like adjusting a thermostat. It is not switching the power off. There are two types of immunomodulation: active and passive immunomodulation. Active immunomodulation retrains the immune system to accept the pregnancy. It is safer, more effective than passive immunomodulation. So let us see the difference between passive and active immunomodulation. Passive immunomodulation are medicines that temporarily modulate or suppress the immune activity. It may calm some symptoms, but it does not correct the root cause. The immune system in pregnancy doesn't need to be stopped, it needs to be guided. Pregnancy needs education of the immune system, not suppression. That's where active immunomodulation becomes critical, training the immune system to recognize the pregnancy as friendly and not foreign. Immulate is our patented and branded process of active immunomodulation based on lymphocyte immunization therapy. This is where it fits in. At Dr. Raut's Center for Reproductive Immunology, we work exclusively with couples facing recurrent miscarriages, repeated IVF failures, and unexplained infertility using structured immunological evaluation. We identify immune rejection when present. When indicated, Immulate helps restore immune tolerance, allowing pregnancy to implant, progress, and sustain. It is done only once. Immulate is not a replacement for IVF. Remember that it is often the missing piece that finally allows IVF or natural conception to work. If you've been told everything looks perfect, but your heart keeps breaking, please remember this. Pregnancy is not just about creating life, it is also whether the body is ready to accept it. Sometimes the answer isn't more cycles, it's a deeper conversation. Thank you for listening. And if this resonated with you, share this live because someone out there needs this answer today. Knowingly or unknowingly, you may help at least one couple. You can contact us on +919833201522 or visit our website www.icprm.in. I'm seeing a few very similar questions coming in. So let me address them together. The first question is, Doctor, all my reports and embryos were very good. If the problem is immune related, why was this never picked up earlier? Now, that is a very important question, and we hear this very often. Most routine fertility tests are designed to look at the structure, hormones, scans, chromosomes, embryo quality. The immune system doesn't show its imbalance on these reports. It works silently, especially during implantation. So, unless we specifically look at immune behavior related to pregnancy, it can easily be missed. And that's why many couples are told everything is normal, when in reality, something important was never evaluated. The next question is, at what point should we start thinking about immune evaluation in repeated failures or recurrent miscarriages? Immune evaluation should be considered when outcomes don't match expectations. For example, good embryos, good endometrium, but repeated failure, or recurrent pregnancy losses without a clear genetic or anatomical cause. At that stage, repeating the same approach may not change the result. A structured immune evaluation helps us understand why pregnancy is not being sustained before trying again. Now, the third question is, if immunomodulation is needed, how do you decide which patients actually require it and which do not? Now, here the answer is, this is where individualized care becomes crucial. Immunomodulation is never given empirically. It is based on immune patterns, whether there is excessive activation, inadequate tolerance, or a timing mismatch. Not every patient needs it, but in the right patient, at the right time, targeted immunomodulation can completely change the outcome. That's why diagnosis comes before treatment. In reproductive immunology, the goal is not more treatment, it is the right treatment for the right patient. Thank you.